Good morning, everyone. Welcome to our virtual Rural Child Hunger Summit. We're so glad that you're joining us. We have a lot of great content to share with you throughout the day, but before we dive in, I just want to cover a few housekeeping notes. All attendees are in listen-only mode, which means that you are muted, but we still want to hear your questions, so throughout the webinar, as you have questions, please go ahead and send them in the Q&A section of this webinar. If you have a comment that you'd like to share with all attendees and speakers, you can use the chat function, but please do use the Q&A function for all questions. Lastly, today's webinar will be recorded, and recordings and slide decks will be sent out to all who registered for this event via email, and we'll post recordings and webinar slides onto our Center for Best Practices website. At the end of today's webinar, I will chat the link to our next session so that you can seamlessly join at 11:15. Our next session is Racial Equity and Community Resilience in Food Systems, Policy, and Program Delivery. And with that, I will hand it over to my colleague, Courtney Smith, to kick us off. Courtney?
Thank you so much, Emily. Good morning, everyone. My name is Courtney Smith. I direct our No Kid Hungry Center for Best Practices. And on behalf of myself and my colleagues at Share Our Strength, I'd like to welcome you to the No Kid Hungry Rural Child Hunger Summit. We're coming to you from living rooms and home offices across the country and are so grateful that hundreds of you have registered for sessions throughout the day. I wanted to say a special thank you to the sponsors of the Rural Summit, who have been so supportive of this work and our change to a virtual platform. So a big thanks to the Arby's Foundation, C&S Wholesale Grocers, and the Walmart Foundation. I'd also like to thank our friends at the Children's Hunger Alliance in Ohio for all of their help in planning the original summit. They're great partners and are doing so much right now to ensure families have access to food during school closures in their state. We hope to be back there for a future summit. The world and our country is in a very different place than it was when we were finalizing the agenda for our summit just a couple of months ago. Although we wish that we could all be together in Columbus for a full convening, moving to a virtual summit has allowed us to be more creative and flexible in the content that we can provide today. So in addition to presenting some of our original content, we've also carved out some time to talk about how the COVID-19 pandemic is affecting rural areas, what we're hearing from the field, and the challenges and opportunities to support rural communities during this crisis. Other sessions throughout the day will focus on racial equity and justice in our food system and the social service net, safety net, the leadership of Native youth in addressing child hunger in their communities, healthcare's role in feeding hungry children during a public health emergency, and working with rural communities to co-create solutions and build capacity to address hunger. There were also many sessions from our convening that we were not able to fit into this virtual summit, but we plan on featuring additional content throughout the year, so please stay tuned and we'll be in touch. This morning, I want to begin by sharing some of what No Kid Hungry has been working on in response to the coronavirus and school closures. And then I'm thrilled to be joined by two national anti-hunger and child nutrition leaders, Jeremy Everett and Gay Anderson, who can provide their perspectives working with rural school districts and communities across the country. As Emily said, all webinar slide decks and recordings will be shared with registered attendees at the end of the summit and posted on our Center for Best Practices website. As schools began to close across the country, we were really concerned about all of the kids who would no longer have access to critical school meals. One of the first things we did was to establish an emergency grant fund to support school districts and nonprofit organizations in their efforts to ensure kids get the nutritious food they need. We know that it's essential that organizations and schools have the staff, equipment, and resources needed to quickly respond and get food to children and their families. We are so fortunate to have been able to grant $3.9 million over the past 2 weeks, with much more to come. If you're interested in applying and you're on the phone, or if you know a school or an organization that should apply, they can submit a grant inquiry, and we'll be sharing a link shortly in the chat box. We also have several resources for program providers, including an FAQ on child nutrition program operations currently available that we continuously update based on new program guidance and waivers issued from USDA. Our other resources share promising strategies and tactics for meal service during school closures based on what we're hearing from program operators around the country, and a summary of the waivers issued to date. I will send links to those resources in the chat box as well. In addition to supporting organizations and schools, we also wanted to do everything we could to ensure that families knew where they could access meals during these unsettling times. So we've expanded our summer meal texting service to help connect kids and families to meals. Our texting hotline is currently running in more than a dozen states. In those states, parents and caregivers seeking meals for children can text the word food or comida to 877-877 to find emergency food distribution sites in their neighborhoods. We're continually adding new states and new sites to this service, already have more than 13,000 emergency distribution sites available in the system. And more than 17,000 families have been connected with these resources since launching the service last week. Finally, we've been working closely with Congress, USDA, and governors to ensure that families, schools, and nonprofits have the support they need during this time. There's been a lot of good news so far. We're pleased that legislation has increased funds for flexibility in federal nutrition programs, authorized pandemic EBT to provide families with increased resources when kids aren't in school, and increased funding for TFAP. And there are provisions that will be especially helpful to rural America, including investments in rural hospitals and Indian health services, as well as funds to boost telehealth services. But there is more to do and more that is needed to ensure child food security during this crisis. So we will continue to advocate for needed supports, including important provisions to strengthen SNAP. Now, I'm so pleased to introduce our guest speakers. Just as a reminder, questions for them can be posed in the Q&A box. I'm going to go ahead and introduce our first speaker, Gay Anderson. Gay is the Child Nutrition Director for the Brandon Valley School District in Brandon, South Dakota. She is in her 16th year with the school district. She has worked with a number of rural schools in her state to secure procurement to assist with their success. Gay is the president of the National School Nutrition Association for the second year in a row. I've asked Gay, as the SNA president and someone who has a great deal of experience working with rural districts in South Dakota and across the country, to tell us what she is hearing from the field, the challenges and responses of rural districts, and the support they need right now. So with that, I'm going to turn it over to you, Gay.
Well, thank you, Courtney. Thank you, Share Our Strength, and the sponsors for allowing me to be a part of this virtual conference today. Truly honored to be able to share some experiences so that others can hear what is going on and others could possibly get some ideas on things that are taking place. I'm going to probably start out with a little bit of a personal side with my own school district. It was March 13th. I was actually taking half of a day off when I saw a notification come through on my phone that our governor said schools would be closed for the next 2 weeks. So I knew at that point I needed to come back to work and enact, get things rolling for my own school district. We're a school district right outside of Sioux Falls, South Dakota. We have about 4,500 students, 7 schools, and it's like, okay, what are we going to be doing? How quickly do we mobilize things? But we want to be putting food on into bags and sending them home with students the following Monday. March 13th was a Friday. Quickly wondering, well, how will my staff even want to assist? And I have to tell you that it's pretty cool and touching to know the passion that not only my own staff, but people from across the country have for feeding children. They're frontline people, and they are such heroes in my mind. I had to tell some that due to their own specific health concerns, that maybe you should stay home and not worry about things. And so we have plenty of help. We're being conscientious about rotating them out. We have 2 where we're trying to work out of a couple different prep kitchens, but one is a main kitchen. And as of yesterday, we became a 4th feeding site, adding another location. But the interesting thing is already in that first day of serving kids, we started seeing different looks in people's eyes. It's interesting how we can change from such a um, everyday natural world, happy-go-lucky group of people, and over the course of a few days, things change ultimately, and we start seeing life differently and start seeing fear. And actually, day one, it was like, okay, how many are we going to feed? We don't know. We overshot by about 150 meals, but that's okay because we had some ready for the next day. By day three, we were now going into a snowstorm and rain, high winds, and it was going to be cold. And we decided we were serving out meals for the next 3 days so that we would not have to be standing in the middle of a blizzard trying to figure out how to feed kids, doing some curbside service and all that. And this has happened not only in my state, I know of others across the country who've dealt with quite different weather conditions and yet are still feeding kids. Everybody had to mobilize quickly and start thinking, gee, what are we going to do? How do we get approved? And luckily in my own district, we were a summer food service location. So we were able to start that right away by actually going with what we call seamless summer option based on what our state agency recommended. And so the weekend was spent actually getting things ready so we could be approved to do this. Thankfully, USDA has been working with us over the last 2.5 weeks unbelievably well. And I think Courtney alluded to that also. USDA has begun approving state waiver requests to allow service in non-area eligible sites. And the USDA and Congress are finding other ways to reach students in rural communities, like through the pandemic EBT cards, as she mentioned, in partnerships with the private sector. And when Jeremy talks, I'll look forward to hearing his update there. But I think it's really neat to hear the stories and the ingenuity and dedication of my colleagues in rural communities as we work to find new ways to serve our needy students. And start talking about some of the different things there. Actually, school nutrition professionals, those of you that have heard stories about school nutrition, we're a group of people who share everything, our successes, things that don't work so well. As one colleague always refers to it, we do a lot of R&D, and that's instead of research and development, it's rip off and duplicate. And trying to put a little humor into life because I think we need to do that too. And so we've shared our stories, what's working and how quickly can we get things going. Many of us started right away thinking that, well, let's just do cold sandwiches. That's what we'll be doing. But now as we're getting more and more long-term in, we realize cold sandwiches are going to get old really fast. And schools across the country have a lot of inventory on hand that they need to be able to draw down so they don't have wasted food there. It's interesting, colleagues across the state who've never served meals outside of the regular school day, they know that they want to take care of their communities. And literally, actually, people have seen how rural South Dakota can be, and rural is rural wherever we are and however we understand it. But people have limited student access to transportation or even safe walking paths to access these meals. And also the challenge of serving students spread out over like some of the large districts that are still rural, where the program may be only authorized, or they're only equipped to serve from a few school sites. So how do we overcome those challenges? And again, with USDA's flexibilities, we've been able to open up some additional opportunities and ways that we can have more locations available. Some of the concerns on some of these sites that have had to be closed sites. Imagine this, you have a family pulling up with 4 kids in the car, and the closed sites were supposed to be then only rostered children in your school district. Let's say you have 2 kids that are rostered, but the younger 2 in the car, still in car seats, are not rostered kids. And the parent is asking for 4 meals, and you have to say, I'm sorry, we only have 2 that we can give because we have to go with our rostered kids. That's been very hard for a lot of colleagues. And thankfully, with some waivers that came out again as recently as Friday, we are able to go with and Friday and yesterday, Monday, we were able to go with number 1, no child present in the car, because that's been hard to tell a parent you came all the way here and sorry, if you don't have your kids in the car, we're not allowed to let you take the food home. Or in those cases where they don't have rostered kids, not allowing them the meals. So thankfully, again, the waivers that we've been able to get through USDA, and one called No Child Present, and also then opening up our sites to being where they're open sites instead of closed sites, has made a huge difference in that type of thing, because nobody wants to turn away a hungry child. Other situations, SNA actually, the School Nutrition Association, put together a quick survey to assess the COVID-19 feeding plans. And we did that from March 12th to the 16th, looking ahead on things. And we started putting together some different resources where one with USDA, working with USDA on strategies for our COVID-19 meal service, getting the word out about emergency meal service. Another for industry partners, how to support our programs, how they can help us out. And actually, we've been doing a series of webinars now, and our webinars are open to all SNA members and non-members, because we feel this is so critical in this unprecedented crisis. We want to support all school nutrition professionals to hear what's going on. So April 1st, actually, we have one that we're going to talk even on the wellness of how to care for ourselves or your students during the crisis. And then in April on the 8th, we're going to talk about how to lead school nutrition teams in a virtual world, and we're working with many more. But we've also received a number of comments from colleagues across the country with concerns, and some might pull at the heartstrings as I share these with you here. One is, we're in a rural district spread out over a huge area. I guess my concern is that out of 8 schools where we supply meals for, only 2 of those schools are 50% free or reduced. What happens to the other children in my other 6 schools? Again, hopefully with the recent waiver yesterday on opening sites up to 18 and under, this hopefully will be able to, these sites will be able to open up more locations and be able to offer that to more kids in their community. I alluded to about being, having to walk a long ways or whatever. Here's one. Our school's located in a very out of the way location. The kids would have to travel up to 12 miles to get a meal. There's no sidewalks for them to get safely there. We have no restaurants, community centers, or other establishments that we could set up at that would be any safer or closer to them. Our school does not have the funds to deliver meals to the homes, and I know a lot of the children, and they know if they are hungry, all they have to do is come by my house and I will feed them. This goes for my staff. We love these kids and would welcome them in our home anytime to help them. Another comment here, we're a spread out rural farming district. We have some schools in our little town, but another school is 22 miles out in the boonies and another one 11 miles away. The students that would be most helped by food provided by school are the ones that live in the country at the most rural schools. Kids can live up to 25 miles or more away from the school that they attend. They wouldn't be able to access the meals as they would have no way to get to the schools. Many are children of farm workers where both mom and dad are at work in the fields during the day. And with that comment, just sharing some creativity that schools have been doing. Some have actually gone back to pulling out their buses and doing bus routes and delivering meals to students that way on the regular bus route, having a way to drop it off so somebody can pick it up. A lot of districts I have heard about, currently in my own, we're still serving 1 day at a time when possible, but some are doing 2 or 3 meals at a time, days worth of meals at a time, so that they can limit the amount of time their staff are spending together and doing more prep in those other days, and it's trying to get the food ready for that. So busing has become a really unique part of providing meals right now for a lot of these rural students. Many people are trying to figure out what kind of meals to send home, because while yes, there is a good amount of food available, some of the food available for us in school nutrition that we typically provide comes in bulk, not pre-wrapped or packaged or whatever it may be. And now we're all grappling and fighting for the same things, like maybe a pre-made grilled cheese sandwich that's individually wrapped, or some other individually wrapped items that we can say actually save us time and labor, not the labor part, because we're paying all our staff to still, or in many situations, our staff are all being paid whether they're working or not. But what kind of food can we actually be utilizing? And so when we go to place our orders, we think we're going to get this, and then it's not available. I mean, who knew that carrotinis that come prepackaged, when you buy them by the case, 200 per case, and they count as a half a cup vegetable, would be such a hot market item, because those are so easy, and we know that kids eat carrots, and they're pretty hard to find right now these days. Some of the other things, literally, we've got some milk companies that were concerned about how much milk should they be providing, and so they have been short in some situations. And I even ran into that in my own district, where it's like we didn't have milk one day, and I ran to a competitor to pick up the milk needed for that day so I could still provide the milk in my own district. So there's a whole plethora of stories. There's a whole lot of things going on. On the flip side, there's a whole lot of good people out there that are still wanting to be feeding kids, taking care of them, looking to see what can be done, and looking for continued better ways to do this. Food safety is another piece that we have to focus on. We've got to make sure that we do not go and put kids at risk with what we're sending them. So we need to tell them how to take care of the food that we send. So I don't want to take up all the time, but I think those are some of the key points that I wanted to share. That, there's a lot of neat ideas, a lot of ways that many of us want to continue to feed kids, and that we're always going to be looking for new ways that we can improve on what we're doing in this unfortunate new normal that we're dealing with. And so with that, I'm going to stop here and turn it back to Courtney, and look forward to hearing Jeremy's update.
Thank you so much, Gay, and thank you for everything you are doing in South Dakota and across the country. I'm going to save most of the question that people are chatting in for the Q&A after Jeremy speaks, but I just did have one kind of immediate follow-up from someone. They wanted you to just clarify which waivers you've gotten in South Dakota that have been really helpful.
Okay, the waivers that I've received in South Dakota, number one is the no child present, which is very significant. And then the one that came out over the weekend from USDA, where you could go to be allowed that sites now no longer have to be closed sites, and they can be open for 18 and under. And that, I don't have a name for that. That came from our state, that they received that over the weekend, and we're just sharing that with everybody. And if they've got that, that would be across the country.
Thank you so much. And we also have on our resource guide a description and summary of all the waivers that have been approved to date. So we can, again, send you a link to that in the chat box as well. Now I'm so pleased to introduce our next guest speaker, Jeremy Everett. Jeremy is the founder and executive director of the Baylor Collaborative on Hunger and Poverty. The collaborative integrates research and practice through projects such as the Texas Hunger Initiative, the Research Fellows Program, the Global Hunger and Migration Project, and the Hunger Data Lab. Prior to launching the collaborative in 2009, Jeremy founded and served as the executive director of the Texas Hunger Initiative, an anti-hunger project within Baylor. Jeremy is the author of several books, including recently published I Was Hungry, Cultivating Common Ground to End an American Crisis. I've asked Jeremy to talk about Baylor's work in rural areas, the Meal to You program, and how that will feed kids in rural areas during this time, and what he is hearing from rural school districts and organizations in Texas and across the country. And with that, I'll turn it over to you, Jeremy.
Thanks, Courtney. It's good to be with everybody today. And I am very grateful for what Gabe presented. It's incredibly informative. I was taking notes vigorously so that I can share them with our team to make sure that we're doing all the things that she said that they're doing in their community. And so it's Grateful for Share of Strength bringing us all together. Rural hunger is something that, we're just now, I think, as a nation, really putting a spotlight on and trying to figure out some of our both best practices and evidence-informed models that could really reduce hunger and poverty for many people who live outside of our urban areas. In Texas, oftentimes you'll hear people talk about 50% of our population lives in urban areas, but that also necessitates that 50% live in our rural areas. And though that's a high percentage certainly for a state in our nation, but we do know that many states experience this reality on a regular basis. And so trying to figure out some creative ways to ensure access to enough healthy food for everyone to live an active, healthy lifestyle, regardless of where they live, is such an important cause. And we're very grateful for Share of Strength to pull us all together today. So I'll tell you a little bit about a couple of things. One, a formative experience that I had when I was serving on the National Commission on Hunger with Billy Shore, who works with Courtney. We were visiting some colonias on the Texas-Mexico border. And colonias are essentially unincorporated towns. And so it's not uncommon for them to maybe not have paved roads or running water or even electricity in certain circumstances. And we were visiting with a professor named Dr. Joe Sharkey. And Dr. Sharkey was a professor at Texas A&M. And he was telling us about some work at one of the public hearings that we had, telling us about some of the work that he was doing in with some public health work he was doing in one of the colonias that was relatively near to El Paso. And he said that he had a public health worker going door to door, essentially doing a survey to find out about the health and well-being of the people that were living in the colonias in this particular area of Texas. And he said that one of his public health workers knocked on a door and was invited in by a woman named Maria. And she asked her, the public health worker asked Maria a survey, worth of questions, and developed a little bit of rapport in a very short period of time. And her final question was, do you have any food in the house? And Maria's head kind of lowered under the weight of shame and guilt, and she guided the public health worker into this area that kind of served as the kitchen, where she had a small refrigerator. And she opened up the refrigerator door, and the public health worker looked in, and it was just a bag of chicken bones in the fridge. The public health worker was puzzled and asked Maria, she said, why in the world do you have a bag of chicken bones in the fridge and that's it? And she said, this way, when my kids get home from school and they open up the refrigerator door, at least they'll see that something's there. That was one of those experiences that left an indelible mark on me and I think many members of our commission at that time. And I think one of the things that it points to is that, for our families in rural communities in Texas and around the country, experiencing hunger is not new to the COVID-19 epidemic. They've been experiencing hunger and poverty, many of them for a long time, some of them for many generations. And so this is a problem that they've struggled with for a long time. And this situation that we're in right now with the pandemic is only worsening their situation. And so I think anything that we can do, both thinking about how we, in the short term, make sure that they have access to food so that at least their children don't have to struggle with food insecurity during this incredibly stressful time that we're experiencing as a nation, but also thinking about what we're going to do in a post-pandemic response. One of the things that we launched, we operate from a philosophy that hunger is too big for any one person or any one organization or even any one sector to address by themselves. We think that the problem is large enough. Even before the pandemic, you're talking about 40 million Americans that were food insecure. And so we believe that in these kinds of situations, it requires everybody working together. It requires the government working in lockstep with the nonprofit community, with the faith community, with the corporate community, with the research community. It requires us all working together seamlessly in real time. And so one of the things that we have built over the past decade are hunger-free community coalitions. And on a local level, essentially, that's where you get your local government, your school districts, your nonprofit organizations, and faith communities, and so forth, all around the table, essentially, to look at the scope of food insecurity in their community, to make data-driven decisions across organizational barriers, so that The community is identifying where the gaps of services are, and then as a community responding to those gaps instead of just asking one organization to try to fill all of those gaps, which typically isn't sustainable. When that happens, and what we've seen during this COVID-19 crisis is that that communities that had built these hunger-free community coalitions, we have about 30 in Texas representing about 60% of our population, they were ready to operationalize and come to the aid of the schools and the children in the community as soon as school closures were announced. Whereas some of our other communities that we've worked with were a little bit more slow to respond because the school districts were largely having to operate independently of the community, or maybe just with some elected officials providing input. And so we've been able to provide more wraparound services and get information out, like all these waivers that are happening on a daily basis. We're hearing about more waiver opportunities. And so many of our states are applying for those, but they also oftentimes need to hear from our local communities to what they need. And so these hunger-free community coalitions provide a conduit for information. So that's something that we certainly encourage. We think that's a great both pre-pandemic and post-pandemic response mechanism, and certainly during the crisis, it seems to be helpful. We have a toolkit for how to create these hunger-free community coalitions on our website, hungerandpoverty.org. So hungerandpoverty.org, and you can click on a hunger-free community toolkit and download that for your community. Something that we just launched with USDA is a federal response to the COVID-19 crisis specifically, and it's called Emergency Meals to You. And that's something that was born out of a pilot project that we had just piloted last summer in East and West Texas. Part of our job as a university-based project is to do research and innovation to try to identify scalable solutions to addressing hunger around the U.S. And so we partnered with USDA last summer, recognizing that many kids who live in our rural communities across the country don't have access to a congregate meal site. To Gay's point, they live too far away to be able to drive or walk to a congregate meal site. And so rural America is largely left to its own devices during the summer. And then we tested out a summer EBT model where essentially we put extra resources on a SNAP or WIC card for families, which was a wonderful intervention nationwide and typically had an 80 to 90% take-up rate. But one of the things that we also found with that program is that though it worked incredibly well in urban and suburban areas, it did not work very well in our rural communities because they didn't have access to a grocery store. So our kids their families couldn't go get groceries very easily, and they couldn't access congregate meal sites. And so we partnered with McLean Global to develop a model where essentially we mailed children a box of food per week over a 10-week period in the summer. And so we had 20 different school districts that were a part of our initial pilot, and they recruited 4,000 kids to be a part of the initial pilot. And then kids have to apply because of FERPA laws. Their families have to choose to opt into the program, and they have to be a part of the free and reduced lunch program or at a community eligibility provision school. And then once kids apply, our team vets those applications in partnership with the state and the school district, and then we're able to begin to mail them boxes. And so McLean Global puts together in the summer pilot, they put together 10 meals, so 5 breakfasts, 5 lunches, and 5 snacks. So 10 meals and 5 snacks per box per child that were mailed out on a weekly basis. And so that intervention ended up leading to us serving about 480,000 meals and snacks to kids in rural East and West Texas that would not have gotten a meal that provided by USDA otherwise. And so the intent was to scale that program to a tribal community in New Mexico this summer, and then to the state of Alaska, in addition to continuing the response in Texas. The Urban Institute we have a team of researchers there that are doing the evaluation of the project with some of our researchers at Baylor. But when this COVID-19 crisis hit, we realized in conversations with USDA that this was something that we could scale nationwide to be able to address the hunger problem that we knew was going to emerge due to COVID-19. So In partnership with McLean Global and PepsiCo and USDA, we launched Emergency Meals to You. And so Emergency Meals to You is now a program where school districts that have rural schools, it doesn't have to be a purely rural school district, but school districts that have rural schools where they may not be able to provide curbside meals. To Gay's point, many curbside meals are a great way to provide meals to kids in areas where kids have transportation or families have transportation and can get to meal sites, but in our rural communities, that is certainly prohibitive. And so we're partnering with USDA to serve, the initial estimate is about 100,000 kids per week nationwide as individuals and families sign up. So the process is, our team has been working with all 50 state agencies and representatives in the territories to help them understand essentially the process by which they need to, they can apply to be a part of the Emergency Meals to You program. They then communicate with their school districts that could be a good fit for the program. And so if you have a rural school district or an area that is hit incredibly hard by the COVID-19 crisis, where you can't provide curbside meals to everybody, then those school districts in partnership with the state will apply on our Emergency Meals to You website, which you can get to through our same website, hungerandpoverty.org, and click on the Emergency Meals to You tab. And a school district can apply. Once the school district is approved, then they communicate with the parents in their district and encourage them to apply. And once parents have applied, because of FERPA laws, again, the schools can't just provide that information directly to us. But once parents apply and are approved, then they're going to get a box of food that will be a breakfast and a lunch. And we're actually going to be mailing those boxes out in 2-week increments. So essentially, a child will receive 20 meals. It's shelf-stable meals. We know that just in part because of shipping, they have to be shelf-stable, but all the meals are compliant with the SFSP guidelines listed by USDA. It's no cost to the school district, no cost to the community. This is something that USDA and Congress have aptly provided for. If we get in excess of 100,000 applications, which we're anticipating we probably will based upon initial estimates that have come in over the weekend, then we'll see about if we have vendors and if USDA has the capacity to expand beyond the 100,000 kids, then we'll certainly do that. So with that's essentially what we're doing. We also have additional resources for communities that if you don't want to do the Emergency Meals to You program, we have some additional resources on our website, hungerandpoverty.org, to be able to show some best practices that have been identified by our field offices. We have field offices around Texas working directly with school districts, and so they've tried to capture some of that on the website. So with that, I'll turn it over to Courtney.
Thank you so much, Jeremy. We only have a couple minutes for Q&A, so I just want to jump right into it. And for Jeremy, there's a few questions on how quickly will districts be approved for the rural meal delivery, and then if you can give some examples of what type of meals are in the shelf-stable meals that are being mailed out.
Yeah, great questions. So in terms of how quickly, it in part depends on the school district. And so when you go on to the Emergency Meals to You tab, if the school district has been in conversation with the state already, and the school district fills out, there's a school district tab on the Emergency Meals to You website, and they just fill that information out. We right now are working with, probably well over 50, maybe over 100 different school districts in terms of right now approving them to be a part of our program. So it probably would take, it just depends on the demand side, but it would take anywhere from a couple of days to maybe 3 or 4 days, I would imagine, before you're approved. In terms of the food that's in there, so for breakfast, it's going to be whole grain and shelf-stable milk, as long as the milk supply is out there, which shelf-stable milk right now is a little bit under-resourced, and so we're having to work very diligently with the Dairy Association to try to be able to ensure that we have access to enough shelf-stable milk for these for 1 million meals that we'll be serving on a weekly basis through the program. And then you have chicken and tuna fish, and some. We have a beef producer who provides a whole a locally sourced from North Texas, a locally sourced free-range beef steak that he provides to us through the program. And so it's those types of foods we also have on our website and are going to be making available so that people can see what a shelf-stable box will look like and see if that's a good fit for their community.
Thank you so much. And then coming in for Gay, similar questions. What types of food are you distributing? Are they hot, balanced meals or non-perishable items? And if you could talk a little bit about the nutritional content.
Certainly. We still do have to follow what the National School Lunch Program guidelines are. And so we are providing 2 ounces of protein each day, along with 2 whole grains, the half cup fruit and 3/4 cup of vegetable for our older kids, and then the 8 ounce milk. And so what we started with this week, we have in our freezers actually some pre-cooked hamburgers. So basically we came up with certain kinds of ways to package the meat so it's microwavable with instructions. And then we have the rest of the meal all put together in bags so kids can actually have a hot hamburger. Today they're actually going to be getting some chicken tenders and some dinner rolls for a variety of things, and we do provide the cooking instructions again. Can be so it's also ovenable too, but just trying to give them a little bit of variety, because again, with school districts that have these large inventories, we have some other concerns with dealing with USDA commodity foods, trying to draw those down because we'll be looking at what we need to be utilizing already next year. We don't want to have those dollars worth of food swept away. But we're looking at great different ideas for that. What Jeremy mentioned, shelf stable, a lot of things what we do for breakfast are very easy. Whole grain cereals, whole grain cereal bars. We've got some other things that we're utilizing from our freezers that are, say, an apple fruital that's made with whole grains. And again, just giving them some different variety.
Thank you so much, Gay. I think there's a number of other questions that have come in. Unfortunately, we are going to have to wrap it up in order to start the next session on time. So I think what we'll do is we will try to answer these questions. We will pass them on to Gay and Jeremy if we need help answering them. And if folks have additional questions, they can email them to bestpractices@strength.org, and we'll try to get you the answers. I'm sorry we couldn't extend this further. I want to really thank Jeremy and Gay for being here today, for everything they're doing right now, but most importantly for everything they were already doing to help ensure that kids had access to the nutritious meals they need. It's just been a pleasure working with you both over the years, and I'm happy that, and we're fortunate that you're out there doing this good work. The next session is Racial Equity and Community Resilience in Food Systems, Policy and Program Delivery. We're going to share the link to that session in the chat box now, and that session will start in 1 minute. So thank you so much, and I look forward to joining the other sessions with you throughout the day. Thank you.
Thank you.
Thank you.